And welcome to It's Mention channel. So today we are going to see how to interpret a HSG. So we are going to see how various abnormalities varies from normal to abnormal because many students as well as many practitioners find it difficult to interpret the HSG. So HSG is usually done to check any uterine abnormality or fallopian spillage abnormality in female. So let's begin. First, I have divided this interpretation of HSG in two parts where we are going to see uterine cavity abnormalities as well as fallopian tube abnormalities with their HSG fill. So let's understand first what is uterine cavity in normal HSG, how it is this. So whenever you see a uterine cavity, so it is triangular in shape. This uterine cavity is triangular in shape. So wherever you see a fill, where you see a triangular in shape, any cavity of uterus, it is a normal. Now let's see what are the abnormalities you may see in uterine cavity. So first abnormality you may see it is a T-shaped uterus where the size, where the shape of the uterus it was triangular. Here it is a shape in T, a T-shaped uterus. Now second abnormality you may see a unicornuate uterus, whereas uterus have two corna. This is always a right side and left side. So you may see this is a cornua of one uterus, this is a cornua two, that is left side of cornua. So uterus has normally two cornuas. Now here you may see in unicornuate, uni means one. It means there is only one cornuate. There is no another cornuate. So it is also a uterine anomaly, abnormality you may see in HSG. Now next uterine anomalies, it may include the septate uterus. You may see two cornuas, but between the cornua, between the uterine cavity, you may see a dark hyperechoic line which may be traveling here, which is in dark in color. So you may see this type of thing over HSG. Yes, we are going to see the film also to clear how the septate uterus looks like. So whenever you see a uterus, in middle there is a septum. There is a septum which differs the two cornuate, the right as well as the left. So you may see there is thin uterine cavity you may see here because of the septum. So this septum, whenever present in the uterine cavity, it is called as septate uterus. Now next is arcuate uterus. All the time arcuate uterus are considered normal because difference in arcuate and septate uterus is a septation is more than 1 centimeter you might see. A arcuate is little mild indentation from the normal you may see here. So you might see sometimes arcuate uterus in the HSG film also. Now next we are going to see bicornuate uterus. Bicornuate means it has two cornua, 1 and 2 here, both the cornua which are dividing here. So the uterus is divided into two parts. There are two uterine cavities in bicornuate uterus. Now diadelphys uterus, whereas in diadelphys uterus there are two cervix as well as two uterus. Now next is some abnormality you may see in the uterus like polyp, fibroid or the filling defect like hair bubble in the HSG film, which is dark or it may be white shadow you might be see. We'll see while seeing the HSG film. And the last uterine abnormality is the TB, where you might see irregularity in the uterus shape or you may see a beaded like appearance over the HSG. And the last uterine anomaly abnormality, you might see these adhesions which are called also Asherman syndrome or intrauterine adhesions or synechies. It connects one uterine border to another uterine border, endometrial lining. It may be get adhesified, means it may be get attached or जैसे चिपका हुआ एक जैसे है वैसा. Let's see the HSG films all together and let's interpret. So let's begin with the HSG film. So here if you see, this is the normal uterine cavity and you may see there is a bilateral spill present, that the both the spillage from the both fallopian tube, that is right and left, is positive. Now here we may see there is only one cornua in the left side. So this will present a unicornuate uterus where the cornua is present in left side and absent in the right side. So there is only spill seen in left side. Now this is a film where we see the uterus. It is in T-shaped. So it is a T-shaped uterus. There are some fallopian tube abnormalities in this HSG film. We will going to discuss in the part 2 of the HSG film video. Now this film represent a septate uterus film where you might see there is a septation between the uterine cavity, and here there is a spill from both the fallopian tube is positive. Now this film represent the arcuate uterus, as we have seen a small mild indentation from the uterus from above. So it is a arcuate uterus, and there is some fallopian tube defect which we are going to see in second part. Now here you may see some beaded like appearance or some roughness or irregular surfaces in the uterus. Such kind of HSG film is seen in severe PID or tuberculosis. Now this is another HSG film where you might see some abnormality seen inside the uterus, uterine cavity. It may be a large fibroid or it may be a polyp. You may see a hyperechoic contrast in this. So it is a fibroid in this case. So this is a last film, HSG film, where you might see the uterus shape is not regular. You may see some dark and white contrast. So these are the additions which may be seen in Asherman syndrome, and here there was a bilateral spill present. So you have understood this topic. Even the fallopian tube abnormalities and the normal HSG film has been explained in another part 2 video. Thank you for watching.